Hello, hello. It says scholarly paper, but um, this paper was difficult for me to write because it was part of a consciousness course where I felt I had exhausted my interest. So many, my time at Saybrook was spent diversifying my interest in psychotherapy, in counseling, psychology, in healthcare policy, and I don't know if there's any record of it still. Um, my first residential learning experience at Saybrook, which is a bi-yearly conference required by the clinical psychology PhD program. Um, my first one was done over Zoom due to COVID protocol. But my first one in Pasadena was one where I attempted to go to as many um, lectures that I possibly could, not to, for no other reason other than I was genuinely interested in those lectures. Um, there was one on psychoanalytical psychology and policy, which I thought could better inform my writing for contacting, communicating with policymakers. Um, there was one on spiritual crisis. There was one on managed care in a person-centered, person-centered in a managed care setting. Um, there was a writing workshop. Um, there was ones on existential humanistic. There was ones on person-centered. There was ones on analytical psychology, and pretty much all my days were filled. I also went to a contact hour human sexuality course, and these are contact hours that can be used towards becoming a sex therapist. And no matter what my position is at Saybrook, those contact hours cannot be taken away from me. Um, they offered also, if you want to become a licensed professional in the state of New York, such as a dentist, a nurse, a psychologist, a doctor, you have to take some sort of child abuse course, and you can find that on the Department of Education website, I believe, and Office of the Professionals, and so that's something that's offered. You can go to various places in New York to get those contact hours, but Saybrook also had those courses made available at these conferences. The second one I went to, there was one where I went to suicide prevention. I believe they did have a children's um, contact hours, but I think I took the human sexuality in lieu of, in place of the child abuse course. In the past, I've taken course contact hours on interacting with God's children, so young children. I've also taken a law school course, Children's Health and the Law, and some of my policy and research interests are involving mature minor statuses and adolescents. Executive function, long-term decision-making, cost-benefit analysis, the law of the horse, the rule of seven. So this paper, um, I took, the reason why I was at Saybrook is because of this word, spirituality. So I had found Saybrook by Googling soul psychology, and I wanted to research more qualitative experiences, understand the lived experiences of other people, and study near-death experiences, and the key word, the buzzword, the word that attracted me to the program was spirituality. Um, it was just a bonus that their philosophy aligned with my vision of counseling, my vision of the therapeutic alliance, which is humanistic in nature. And that said, I feel that my pursuits of psychology can be obtained anywhere because that therapeutic alliance is part of who I am, and it's not something that was instilled on me from Saybrook. And I say in some of the courses that my attempt is to see the world through the lens of the client. I mentioned some of this in my law school courses at Seton Hall School of Law. Um, I do have a screen recording of that message, and maybe I'll look for it now. Um,
The phenomenological aspect. Yes, the phenomenological aspect.
I'm gonna have to do a little digging for that one. That one was one I was I was fortunate enough to find it. I had screen recorded my desktop, and I came across some of my law school work, and I had found a screen recording where I had managed to get this quote that I was looking for, and this might be it. Hold on, I think I just found it, and it's not as profound as I thought initially, unless an incursion has changed my text here. Um, I don't know how clear this is going to be. I do have a screenshot of it. Let me see. I just need to blow it up here where I just have to go through the video. It's hard to read some of these. Um, just bear with me. Sometimes I get a little overwhelmed because I've written so much, and even though I have saved much of the stuff, I don't have everything saved, and that's upsetting because there are things that I said that are part of my agenda that aren't exclusive to Saybrook, and I wish I would have. I want more ownership of the thoughts and ideas that I post. Um, my children's health in the law was one of the most cited. spend all night looking for this thing. I think I found it. Let me put a little tag on it. We'll do every tag possible. I don't want it to stand out because that's not something I normally do. Sometimes I will do So here it is. All right, so this is some of the stuff from my law course, Children's Health and the Law. These are the discussion questions, and the way these law school courses um, were formatted was one. These are JD courses, right? These are what law school students will take, and they're presented in such a way where they had discrete tutorial questions where you are asked questions about case precedent and you are expected to give an answer that is either right or wrong, and then you are graded accordingly. For discussion questions, you are given the opportunity to provide feedback or um, contribute answers that are not right or wrong. You might disagree with current policy. You might agree with current policy. You might be asked to um, consider policy that doesn't even exist yet. So these are part of the discussion questions, and I felt that my work in this course, my work early on, um, so I took a course called I took a course called the Law of Patient Care, and this was the course I wanted to take the most, and was the one that I had the most enthusiasm for. It was one where I felt I could advocate for patients and doctors alike. I felt congruent with the material. I remember being in my father's home and discussing with him, and my concern with my father is I had a lot of passion in what I was saying, um, but I felt that my father might be, when I would ask him what he felt, his input, I felt he was defensive of the profession, and potentially he might have thought that I was siding with the patient. That's not true. I've never wanted to be an ambulance chaser. My agendas have been for paperwork reduction acts, for doctors to improve their quality of life, um, reduction of training, um, quality of life improvements for doctors, which includes public perceptions of doctors being some sort of glamorous profession, where I wanted to quell any rumors or optics or public perception that doctors were prescribing medication based on kickbacks from pharmaceutical companies rather than their sound professional judgment. And there were things where I was defensive of doctors and how I wanted to do things that would um, there were quality of life improvements. Now, I also had agendas for patients, things that would reduce anxiety, reduce the likelihood of harm, um, make a more streamlined approach, less locality, more uniform approach, a stronger standard of care where, you know, patients aren't running from one specialist to another, getting different answers, and I wanted to, I felt that, the the patient experience might be anxiety inducing, so I wanted to implement, protections for patients that would reduce the anxiety. What were those protections? Well, that's what research and policy analysis is about, and part of that is surveying, getting some feedback. Um, does such a problem really exist? And is there a solution where even if it's a small portion of the patient population that experiences this anxiety, is there a way that we can improve healthcare to diminish the amount of anxiety experienced so everybody has a positive patient experience? And these have been my agendas since grade school, and that's because I took an interest in science and medicine from a very young age, and I was excelled in math and science, where I was advanced ahead of my peers, where I was scoring hundreds on math exams, hundreds on science exams, and I took ninth grade math and science in 8th grade, and I sacrificed advanced placement to go to Chaminade High School, which I was told had a superior curriculum to the state of New York, where their curriculum was harder, and comparing their version of the Regents versus the Regents I passed for New York State, I scored worse on the Chaminade equivalent. And although I feel like, the math equations, like sometimes when I try and create a math question on for my own, it's one that's not solvable. And I was wondering, were there any of those in the Chaminade one? Um, so here is, right now I'm just overwhelmed. I'm challenging Seton Hall. So my situation at Seton Hall ended where I was dismissed under some sort of vague allegation of sexual misconduct. And I don't know if this was just bullshit wrapped where they had buyer's remorse that they accepted a student that was pending incarceration for attempted arson in protest of, police violence and false imprisonment. And I've been going through all of my communications at Seton Hall, and there's nothing there are no sexual advances, there is nothing sexually inappropriate, there's nothing that wasn't, asked for. They cited unwelcome communications. There's nothing where I was communicating through channels that were provided to me, such as emails and text messages. All my text messages were within the confines of the parameters of a business day. I was sending text as early as maybe, I don't know, 8:30, 9 o'clock in the morning. I don't know if that's because I received a text and I was responding to a text early in the morning. I'm typically not up at that time, but I also sent text as late as 10:30, and really that's not that late. I was receiving text messages from professors, as late as like 9 o'clock, and the thing with text messages, like I don't know about you, but like when I go to bed, I might put my phone on silent or something, and you don't have to respond to text messages immediately. Like that's part of the benefit of the communication. It's one where, like, if you don't have a second, you can wait and you can respond to it. So I was texting through channels that were provided to me, and there were no formal complaints made by other people that I'm aware of. I asked this of the committee that wound up dismissing me, and it was just something that I brought to their attention because I told them, I was honest with them. I said, I'm going through an extreme amount of, stress over the impending incarceration. And it's one of these things like, if I had a spiritual crisis where it didn't matter if I was going to spend 1 day in prison, 2 months in prison, 6 years in prison. I was afraid that as soon as they closed the door, that was it. Everybody else would be raptured. I would be left on earth, and I would be stuck in that cell for all time. And it would be agony. And like I even reached out to a priest. I contacted a priest. And I told him, like, I'm wearing a watch. If you want to know why I wear 2 watches, I have a watch that's a analog Tag Heuer or whatever other type. I have some other metal watches that have a dial, and I also have an Apple Watch. The Apple Watch serves less of a purpose of a time-telling piece, although it does tell the time, as much as it is breadcrumbs, where it has LTE GPS on it, where if I were to be kidnapped, I have a GPS connected to me, where they can't just, dump me on an island, and where is he? I don't know, where is he? And I wrote about this on, social media. I said, I'm afraid of being trapped there. I think it's called the putty cave situation, where the guy got stuck in a cave and he wound up dying. He couldn't move for like 24 hours, and they tried to pull him out. I'm concerned of a situation that's similar to that, except rather than dying, I'm stuck in that state forever, for all time, and I'm immortal. So I'm unable to die, and in my situation, I'm going to be suffocating. And it's the most agonizing experience one can imagine. And, you know, a lot of this is because I experienced what I describe as cruel and unusual mental torture prior to my imprisonment. If this was just, first of all, if those experiences didn't happen, the attempted arson doesn't happen, because that attempted arson was a protest of police violence that I experienced, where I was assaulted by the police, and also false imprisonment, and also the coma I experienced. So I was put into a coma by 911 responders after I called 911 for help. And I was also, so the day that I was assaulted by the police, and then I was falsely imprisoned. So if I didn't have these experiences, that fire wouldn't have taken place in the first place. The attempted arson wouldn't have happened. Also, I wouldn't have had this spiritual crisis, because the mental torture creates, I was reading Dr. Everett Alexander's Proof of Heaven, and he describes an ICU psychosis. And that's what you create. You create a social contagion, where by exposing you to crazy and also acting psychotic, becoming a psychopath, where you are treating someone without human dignity, without respect for civil rights, without respect for the Constitution, without due process, where you are imprisoning people for no crime committed, where I have been the victim of harm, and you start hypothesizing other scenarios of why this reality, why is this happening? And it's a hospital psychosis, I guess, if you want to call it that. And it wouldn't have existed had this mental torture not have existed. Had they honored my directives, don't touch me. That's step one. Why'd you touch me? You said the police assaulted you? Well, fuck me for being assaulted by the police. I guess that gives you the right to assault me again, because now I'm going to spend the rest of my life making sure when I talk about assault, well, there's the assault by the police where they threw a physical punch, and then there's the non-consensual contact where after that assault, they took me to the hospital, and then they injected me with psychotropic medication, because clearly I'm delusional for saying that the police assaulted me, right? So I tend not to call the injection with harmful chemicals an assault, but technically, legally it is. It's a violation of the doctrine of battery, because I don't want to undermine the physical violence enacted by the police. When I say assaulted, I mean the police. They took their fist and they swung them at my body, and they landed substantial blows to my head and stomach. If we're scoring it on a scorecard, there's 0 punches thrown, 0 punches landed for Joya against police. For the police, maybe there's 50 punches thrown and 27 landed, and 2 were body shots and headshots, right? 2 did damage. You know, there might have been some punches to the quadricep. You know, I got fairly strong legs. They're just, but, the blow to the head, it felt like, a funny bone was struck in my brain. That's the remarkable one, I guess. The blow to the stomach, maybe I got the wind knocked out of me or something. But I don't even think. I've had the wind knocked out of me before. And it just hurt. I guess the blow to the stomach just hurt. And So I've walked away from these situations looking like the bad guy rather than the victim, and it's caused me a lot of stress. Um, so I was mentioning how I was open with the situation to to Seton Hall, and they seemed less concerned about pending. They seemed less concerned about arson, and they were more concerned about my reaction to cyberbullying and whatnot. And I told the Attorney General of the state of New York, I said, if you think I went around banging my head for getting the wrong GI Joe toy for Christmas, then you have done me a disservice. Now that's a true story. I did get the wrong GI Joe toy for Christmas, and but I didn't throw a tantrum about it. I said non-suicidal self-injury is a new behavior, and I said, I quoted Dr. Robert Sapolsky, and I basically said, with no outlet, with no legal recourse, with no legal support, without internal affairs helping me, without lawyers helping me, the only direction for my angst, the only direction for my suffering is to go inward. So violence gets inflicted on me because something happens to me, someone does something to me, and my initial reaction might be, let me call the police, let me call a lawyer, let me call somebody who has a job to help others in the situation. And I realize, well, fuck, I've already called these people before, and they say, hey guy, we can't help you. We only help people who are harmed. Oh, it's an ethical violation. Oh, it's unsubstantiated. Oh, it's just a civil violation. Really? This civil violation is causing me physical damage to my body. Okay? And I don't know, I would have to check my letters. I don't think I sent this. I might have sent this to the staff at Yathank. I think I told them, when it comes to heaven and hell, I don't mess around. And there are certain things that are going to prevent me from having my spot in heaven. One of them is violence towards women. So the depiction of me as some sort of violent, hate-mongering individual is incredibly distressing, because maybe you went to college and you didn't know what you wanted to do, and you decided to, major in whatever because it was going to land you a job. I was cultivating the sympathetic, compassionate caretaker since I was 14 years old, and I was thinking about my life in my mid-30s. So I'm going to go to Chaminade High School. That's going to get me into a college in the tier of NYU, where I'm going to study this, and then I'm going to study something um, where I wanted a computer science curriculum, because my vision of the future of healthcare was one that was computer assisted, where where the reduction of training would be that part of the diagnosing burden would be placed on computer assisted diagnosing. And so I wanted to learn something heavy in math and heavy in code, and I also wanted to learn sign language. I never wanted to be a bio major. College was never for the sole purpose of applying to medical school, but this life plan is only considering med school. So I was going to go to college, graduate at 22, and then I was going to go to medical school, graduate at 26, and then I was going to complete my residency, which is when you earn your MD. You become a doctor at the age of 29, and then if you want to specialize, it's another 1 to 2 years for a fellowship. So I didn't want any unplanned pregnancies derailing these long-term career goals, so I decided that at the age of 30, I would get married, and then I would spend 1 to 5 years, I'm sorry, not 1 to 5 years, I would spend 5 years of quality time with my wife alone, where we could travel and just enjoy each other's company without having children, and then at 35 I could have children, where we would have raised capital to be able to provide for those children. And I took into consideration that I wanted to be a leader within my industry, someone who was seen as a credible source of information, where potentially I would write a reference text, peer-reviewed journal article, but I had in my mind that I would have a private practice that others would want to emulate. And that comes with a certain amount of respect. And where I felt I was going to be a stoic leader, one who would put on a front, where I would take my pain, my grief, and I would suffer in silence. Like if like does Dr. Cox do that? They're bringing back Scrubs, and he says something along the lines, if you think that it doesn't kill me when I lose a patient or something after all these years, and you got it wrong or something. Like I didn't want to show that I was deeply affected by loss or tragedy or something, because I'm supposed to be a level-headed leader, right? And there became a point where grief just became overwhelming for me to handle. And the humanistic approach says that symptoms of schizophrenia are an individual's desperate attempt to maintain a sense of self. I am certainly in a position where I am trying to maintain the things I have done. By the way, I've never been diagnosed schizophrenic. Um, I'm trying to, basically I took an oath to my younger self. I said, I'm going to continue with these long-term career pursuits in order, applying the Hippocratic Oath to my younger self, where I had given up advanced placement in order to go to Chaminade. I had given up somewhat of social life in high school, where I had given up a co-ed environment, and I had also given up some of my days off where I had volunteered on holidays such as Martin Luther King Day, where I would spend my time, rather than be with my friends who might have called me, hey, we're hanging out today, say, you know what, I'm actually volunteering at the kitchen, I'm volunteering at the church. All in pursuit of my long-term career goals. I said I owe it to my younger self to continue with my pursuits. And I'm certainly capable of informing policy. I'm able to be unbiased, impartial, and open to criticism and input to help shape policy. Part of my falling out with Seton Hall was the carryover from Saybrook. I had disclosed to Seton Hall that we had some disagreements over the framing of critical race theory, where I said I felt villainized, where I feel it villainizes white people, and I asked, can we reframe critical race theory? And they said, absolutely. And I told Seton Hall that I felt my dismissal from Saybrook was unduly severe, and I felt that Seton Hall had agreed because they accepted me into their program. But it's possible that Seton Hall was contacted by some other party who didn't want to see me continue my education, because they did mention that they were contacted about something. So towards the end of my tenure at Seton Hall, I had disclosed to them, I said, listen, I took multiculturalism at Saybrook. I passed multiculturalism. My grievance, my concern over critical race theory was not addressed in class. It was not something that was brought up in my classroom environment. I did the work. I was open to hearing things about multiculturalism. I listened about cultural humility, cultural opportunities, microaggressions. I read Daryl Wing Sue. I was possibly thinking about writing about him for one of my papers, because he has an interest in health law. And this according to Google or something. I don't know how accurate when I started going over his work, it didn't seem like he was as into health law as advertised, that most of his interests were multicultural considerations. So I had told Seton Hall that listen, I took this course, my syllabus matches the the syllabus it's basically the identical course. I want to know if I could transfer in my course because I don't think right now, given my current frame of mind with impending incarceration, that this is the best course for me to take. I wasn't opposed to taking it in the future, but I said right now, I think it best that I not take this course at this current time. They didn't want to hear that. They weren't open to that, right? And they accused me of being inflexible, closed-minded, I think individualistic, but that's, that's the United States society. Um, I am concerned about the few, the individual. And if it's a situation where you're being more collectivist, I'm interested in getting that person back to, someone who can integrate into their collectivist society. But they accused me of exerting my will over others, and all these things I feel are an attack on my character and everything that I've worked hard for. The person that I've tried to cultivate is someone who tries to gain empathetic understanding from seeing the world through the lens of the client, to see how their emotions are affected by their experiences. And I take a position where I am open-minded and tolerant, and I'm certainly not going to force my values or beliefs on another individual. In fact, at Saybrook, I was trying to train myself to put myself in a position, how can I get into a therapy session where I have differing values from the individual? Will that cause distance between myself and the client? So I tried to go in with a different mindset where I was almost a blank slate, as if I was a person who had no experiences in life. And I felt I was successful in gaining empathy in ways I hadn't imagined in the past. And this is actually when I reached out to Seton Hall. So this happened in the fall of 2022, and after that semester I reached out to Seton Hall, and they advised me not to leave a PhD program for a master's program. But I felt I had reached a point of saturation with empathy, where I genuinely care about my clients, I'm authentic, and where I'm open to their experiences, and now I want to be able to employ some skills so that they don't feel that I'm not doing anything for them. I wanted to be able to provide a service where I was concerned about being too passive in my approach, and perhaps this is addressing a concern that doesn't exist, right? Because I don't have the clinical experience. I don't have supervised hours. I have clinical experience. When I was working at a group home, I had I had better execution of unconditional positive regard, congruence, and empathy than I do probably now, and that's partly because I have a profound mistrust of others, and I'm concerned that I have possible brain damage. I recently had a CAT scan of my brain to see if there was an tumor pressing on my amygdala, or if there was somehow structural damage due to traumatic brain injury, which doesn't just include the police assault and the coma. I had a possible concussion in high school when I used to play football, and I fell down the stairs at work twice while working at a pharmaceutical company, and I was actually out on workers' comp and had recently an MRI when the police assaulted me in December of 2020. So it was 2 traumatic brain injuries in a short period of time, and I was concerned that there were somehow long-term residual effects associated with these brain injuries. And when speaking with the people at the radiology clinic, they told me that basically the scan I was going to get done with contrast might show some acute damage, but I guess they left it open that these things can heal, and it might not show some of the long-term things. They said, because my advanced care directive says no injections, so there was some debate over whether they can give me a scan with contrast. So they wound up not doing a scan with contrast because we couldn't agree that, I was dissenting to care. They said, if you have an allergic reaction to the contrast, we have to treat you. And I said, no way. My advanced care directive says, it basically said it's a DNR. If you see me have an allergic reaction, you just let it ride out, even if that results in my death. This document was created under sound mind, and yes, that's a scary situation. I'm not looking forward to death, but my quality of life has been decimated by non-consensual contact that I rather set a precedent where under no circumstances is it okay to inject me. And I told them, I said, I'm okay with you handing me an EpiPen and me injecting myself, or, possibly taking some sort of, Claritin prior to the procedure. I wasn't consenting to Benadryl. Benadryl can cause dysphoria, and I think I think it has some effect on hormones where it can have delirious effects on the brain or something. Um, for me, it's just one that causes marked drowsiness. It's a very unpleasant feeling. Um, I don't, I've had issues with insomnia my entire life. So Unisom has a Benadryl formula. There's two versions of Unisom. One of them is diphenhydramine. I can't pronounce it, but it's the same chemical as Benadryl, and it causes marked drowsiness. And it doesn't induce sleep. It's such a marked drowsiness that you become startled and constantly knocked out of sleep. So you start drifting away, and then you immediately get startled, or you get startled out of sleep. And I describe something called sleep-induced anxiety, where sleep onset is delayed for the constant anticipation of interruption, and where you're about to fall asleep, but your mind's like, wait, someone's going to interrupt me. someone's about to wake you up, and you're just like conditioned to expect something to wake you from that state, and so anyway, I've already sent correspondence to Seton Hall. I think I've been, mentioning that I had a falling out with them. It's completely unwarranted. I had, the first semester went fairly well. Um, I was anticipating any type of election day stuff, which is something that maybe I'll discuss some other time. But the following semester was greatly affected by my arson case, where I was told by my lawyer that, like, hey, they're running out of time. They want a grand jury this thing next week. And I said, next week? Can you delay it till after the semester? No way. And I was crying that I wanted a shotgun to blow my head off. Now, I think somewhere I forgot to mention, like, had I not had this spiritual crisis, I don't think a year would have been a hard time. Having served, 4 to 6 months, I don't think I could do much more than 4 months in prison. But the thing that, they initially threatened 15 years. So I was protesting violence done to me. Like, I'm not going to stand for, false imprisonment. I'm not going to stand for assault by the police. I'm not going to stand for total disregard for my body. If they want to try and paint a picture, well, you have total disregard for other people's property. You have total disregard for my life. You don't give a fuck about my well-being. And that's scary. It's scary how little you are concerned about my well-being, especially after I say, hey, don't do that. That hurts. Right? You're a psychopath. But I wasn't, overly concerned with about doing. I wrote in a letter to the Attorney General of the State of New York, I don't have any I'd rather be called a criminal than crazy. And my grievance with Stony Brook Hospital is that after being assaulted by the police on December 27, 2020, I left that situation being called both, where I was identified as a criminal and crazy. And that's, you know, unsettling to me. And so if you think I was crying in my home because sheriffs came out, oh, look, he's got guilty conscience. Fuck you. I'm worried that these assholes are going to put me in another coma. I'm concerned that these guys are going to use excessive force that's going to result in the end of my life. I'm concerned that these guys are going to put me, that they're going to cause physical harm to me, right? That they're going to do some damage to my body. I was experiencing post-traumatic stress disorder after prior experiences with the police and 911 responders. My expectations are that these are unhinged, trained psychopaths where they where they it's part of their training to behave the way they do. Oh, if only you were compliant. For what? You're talking about a situation where they came knocking on my door when I was at home, ready to go to bed. No crime was committed. What are they doing in my home? Attempted arson aside, I'm a person who keeps to themselves, and I try not to bother anybody. Right? I respect your privacy. I expect the same in return.
problem with phenomenal consciousness is how does subjective experience exist when modern science stipulates that everything in existence is wholly physical. Klein, 2021. Currently there is no means available for capturing phenomenal consciousness. Klein, 2021. According to Klein, some of the limitations of reality from the materialist science perspective is reality is limited to what we can observe locally. According to Albert Tassi, 2020, the science of consciousness is lacking an agreeable theoretical framework to measure the phenomenon of consciousness. Albert Tassi states that there are three groups of subjective experience. 1. The description of qualitative properties in terms of physical and primary properties such as measuring the color red in terms of radiation. 2. The description of qualitative experiences using physiological process such as perception of the color red in terms of neuronal correlates. 3. And the description of the qualitative experience of the phenomena of consciousness such as how one experiences the color red which emerges on the material basis of neural correlates. Funder, 2019, emphasizes the importance of the present moment in our phenomenal conscious experiences. Experiences form the past, the future, and other places are no more than ideas. They are illusions. Disorders of consciousness. Consciousness is such a rich topic ranging from the mysticism and alter states to quantum theories of consciousness and machine minds. I decided to focus on disorders of consciousness because consciousness is often a phenomenal experience only understood from the mind of the observer. sometimes referred to as unresponsive wakefulness syndrome, where the patient exhibits signs of wakefulness but is not aware. Some patients remain in a versus, others die, and some transition to a minimally conscious state, MCS. The transition from versus to MCS is usually identified by sustained visual fatigue, localization of noxious stimuli, and command following. Indication a patient has left MCS is seen by communication or by the appropriate use of objects. Not all changes in consciousness are brought on by trauma, infection, or substance. Sometimes an individual intentionally enters altered states of consciousness. Lucid dreams are an altered state of consciousness that may be induced without the use of substance. Sofferdudet, 2020. Lucid dreams can be induced for personal enjoyment or as a means to treat conditions like nightmare disorder or PTSD. Some of the methods involved in inducing lucid dreams involves intentional
All right, did you catch all that? I would have read it to you, but dun, 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 dun. That was an attempt at the Mario Brothers song. So there's an app. For a lot of things. Doo-doo-doo. Did you catch that? Little girl, from the day you were born, the very force of Lordaeron whispered the name Shelby. Here's a fax receipt to the number 631-853-6245. And the date is sent 10/8/2024 at 5:43 p.m. Can we zoom in on who this is from? It's from someone named Joya, and the attention is the Honorable James McDonough. Dear Honorable James McDonough, when I last spoke with my lawyer Ira in person, he mentioned that he knew I was the one who wrote the letter he had requested. He essentially told my mother that I was blaming all my issues on the police. When asked what I wanted to be included in the letter, I specified that it should mention my request for asylum due to repeated harm caused by the police. In this correspondence, I will also include an email I sent to multiple agencies seeking help with this matter, as well as additional details about the harms I have experienced. I will also include my advanced care directive. Subject: request for assistance and protection from harmful actions by emergency responders. Dear recipient's name or UN office. My name is Joya, and I am reaching out to you to seek assistance and protection following a series of distressing incidents involving emergency responders in the United States. These incidents have significantly impacted my physical and psychological well-being, leading me to fear for my safety and future in my home country. Incident overview. April 18, 2020. I was mistakenly injected with a double dose of ketamine by an EMS responder who misidentified me. This overdose resulted in a coma. It shouldn't say mistakenly injected. The person intentionally injected me with a double dose of the good stuff. It should say that he misidentified me. So I'm sorry about that. This overdose resulted in a coma, hospitalization in the ICU with a breathing and feeding tube, and subsequent PTSD, including night terrors and a deepened fear of death. My experience is part of a troubling pattern of misuse of ketamine by emergency responders. Tragically, other individuals such as Elijah McClain, a 23-year-old black man, administered a fatal dose of ketamine by Aurora Fire Department medic Jeremy Cooper, have lost their lives under similar circumstances. Actor Matthew Perry also reportedly died after being given a high dose of ketamine. While some might say I should be grateful to be alive, the fear of future harm and the emotional trauma, PTSD, from these experiences have drastically reduced my quality of life. December 27, 2020. I was assaulted by police officers outside a Starbucks despite not being violent. I was punched in the stomach and head, causing severe pain and trauma. Following the assault, I was falsely imprisoned at a nearby hospital where my complaints of harm were dismissed as delusions. During my hospital stay, I was exposed to and contracted COVID-19, further endangering my health. March 2024, two sheriffs came to my home with a court document and became aggressive, trying to prevent me from re-entering my home. I managed to get inside, called my mother, putting on a live stream for my safety. One of the sheriffs then called me on my cell phone and went into my backyard. I pleaded with him to leave me alone, but he ignored my request, broke into my home, and tackled me despite my cries and the presence of my advanced care directive, which I had informed him about. He forced me to drop my directive and took me to the hospital where it was violated again. Although a doctor mentioned I should be discharged within 24 hours, I was held for several days. My freedom was restricted because of an interaction where I was not violent, disrupting my activities at home and further traumatizing me. Efforts to seek justice despite contacting various authorities, including legal counsel, internal affairs, and the involved hospitals, my efforts to receive justice or reassurance have been unsuccessful. My experiences mirror those of others who have suffered or lost their lives due to similar misuse of power and disregard for consent, such as Elijah McClain and Christian Glass. Unlike these cases where the families received damages or those responsible were punished, my basic request for assurance that future harm will not come to me and acknowledgement of the harms done to me have not been met. Request for assistance. I am humbly requesting your assistance in securing a safe passage to a new homeland where I can live without fear of further harm. The repeated violations of my rights and bodily autonomy have left me feeling unsafe and traumatized in the United States. My intention is to contribute positively to society, pursue my career in healthcare and counseling, and ensure a safe environment for my future family. While I understand the gravity of seeking relocation, the fear of future harm and the emotional trauma I have endured make it impossible for me to remain here without constant anxiety and distress. Your consideration of my situation and any guidance you can provide will be greatly appreciated. I'm eager to follow any procedures necessary to facilitate this transition smoothly and respectfully. Thank you for your attention to this urgent matter. Sincerely, Joya. Subject: pursuing legal action against Stony Brook Hospital for violating my advanced care directive and right to bodily autonomy. I am preparing to take legal action against Stony Brook Hospital for administering mind-altering medication without my consent in direct violation of my advanced care directive. My directive explicitly states I do not consent to the administration of mind-altering medications, tranquilizers such as benzodiazepine or ketamine, neuroleptics, or antipsychotic medications. Respecting my bodily autonomy, my directive was carefully crafted to prevent any unwanted bodily contact, including the administration of medications that alter my state of mind. This is not merely a medical preference, but a fundamental assertion of my right to personal dignity and bodily integrity. I have the right to refuse any form of treatment or contact that I find intrusive or harmful to my well-being. Legal context of my case. The right to refuse unwanted medical treatment is protected under New York law and is central to patient autonomy. The recent ruling in Greenberg v. Montefiore confirmed that individuals are entitled to damages when healthcare providers ignore their documented end-of-life decisions, compassion, and choices. This legal precedent supports my case against Stony Brook Hospital for disregarding my explicit wishes and subjecting me to unwanted bodily contact through the administration of these medications. Personal impact. By ignoring my directive, Stony Brook Hospital not only violated my legal rights, but also inflicted psychological and emotional distress. I do not want to be burdened with the violation of my bodily autonomy through forced or unconsented medical procedures or contact. This fundamental disrespect for my wishes has caused me significant suffering, which I should never have been subjected to. Call for accountability. Healthcare providers must be held accountable for honoring advanced care directives and respecting patient autonomy. I am seeking support from others who have faced similar violations and legal professionals' experience in patient rights and medical malpractice. It's time to ensure that healthcare institutions do not impose unwanted bodily contact on patients who have clearly expressed their treatment preferences. If you or someone you know has been affected by such issues, please reach out. Together, we can advocate for the enforcement of patient rights and the respect for our bodily autonomy we deserve. I fear that my deteriorating mental health caused by the trauma I have endured by 911 responders is losing me the support I desperately need for my cause. Despite my best efforts, the weight of PTSD, anxiety, and fear makes it challenging to advocate for myself. It's hard to keep fighting when those in power ignore the very harm that's breaking me down. I just want to live in peace and safety without fear of further harm. Please don't let my struggles diminish the validity of my plea for justice. Advance Care Directive. I, Joya, residing at Remover X, being of sound mind, hereby declare this Advance Care Directive to guide my medical treatment and care preferences in the event that I am unable to make or communicate decisions due to illness or incapacity. Hospitalization and psychiatric care. I do not consent to hospitalization for any reason. I explicitly state that I do not consent to psychiatric care, including evaluation, treatment, or hospitalization for psychiatric reasons. Medication preferences. I do not consent to the administration of mind-altering medications, tranquilizers such as benzodiazepine or ketamine, neuroleptics, or antipsychotic medications. Any medication administered must be discussed with me or my designated healthcare agent if I am unable to communicate. End-of-life decisions. If I am diagnosed by two physicians with any of the following conditions, I have an incurable and irreversible condition that will result in my death within a relatively short time without life-sustaining treatment. I am in an irreversible coma. I am in a persistent vegetative state, and I am no longer able to make decisions regarding my medical treatment. I direct that life-sustaining treatment that only prolong my life without providing comfort or alleviating pain are to be withheld or withdrawn. Artificial life support systems are not to be used to keep me alive. Artificially administered nutrition and hydration, food and fluids are to be provided. Pain management. I desire to receive treatment for comfort or to alleviate pain. However, I do not consent to receive pain medication without prior discussion with me or my healthcare agent. I do not consent to the administration of injectable drugs without my explicit consent. That language is going to be changed. It already has been changed. No injections. Organ donation and donation of body. I do not wish to be an organ donor, which brings up the point. Is your license an advanced care directive? If so, it's legally fucking useless without two witnesses signing it. Why? Because it has this, your wish is to be an organ donor. You either want to be an organ donor or you do not want to be an organ donor. Either way, those get included in a living will, an advanced care directive, and that needs to be witnessed by two people. Healthcare agent. I appoint name of healthcare agent. I appoint my sister. Her name is Allison. Residing at, I know her address, I won't say it here, as my healthcare agent to make healthcare decisions on my behalf if I am unable to do so. My healthcare agent is authorized to interpret and enforce this advanced care directive. Revocation of prior directives. Old healthcare directives should indicate these same wishes. This directive was intended to clear up language on end-of-life decisions and be ironclad in order to prevent unwanted bodily contact. Signature and witness. Signed this date. The original was signed by Mommy and Daddy. Well, now, so I brought it to the attention of Honorable James McDonough in October of 2024 that I don't consent to any of these things. fax app.
We're an hour and 54 minutes in. There are 0 viewers.